All right, so what I always say when I'm being videoed, whatever I say doesn't supersede what's in the manual. You should read the manual.
Disclaimer.
Yes, exactly. So when you're done the procedure, we already rinsed the tip of the scope so that we wouldn't get a clog, and we blew out the excess water that was in the water channel by putting our finger over where the water bottle was and pushing down on the blue button. Then the excess water will come out, and then you'll just get air. That'll prevent clogs. And it's good to do that before you wake up the patient. So now you can hang the scope up, wake up your patient, come back for the true cleaning. So you don't have to have this hooked up. I just have it hooked up so I don't have to hold on to it. And I do this slightly different than what's in the manual. This cap is a soaking cap and it goes back on here, okay? And then you take your leak tester, and this end of the leak tester connects to that soaking cap and it locks on. Then you'll pump up that leak tester until it's in the blue area, and then that needle should stay put. If it starts to slide, that means either that's not on properly or there's a hole in the outer covering of the scope or in the channel of the scope. If that happens, you just wipe down the scope, give us a call, and we'll get it in for repair. But there's no leak in that leak tester, so in the scope. So we'll push and hold the button and release that pressure. Take off the leak tester. Now, this entire scope can be submersed in fluid, okay? So what you want to put it in, and I personally don't put this part in, but what you want to put it in is a neutral pH enzymatic cleaner. Okay, and we can recommend some different brands. This whole thing can go in, and then what you do is you suction some of the enzymatic cleaner up through the scope. So it'll go from the tip all the way through the insertion tube, through the handle, back out, and come out your suction tube. So I do leave it hooked up to suction.
When you say that whole thing, you're talking about the whole thing?
Yep, sure can.
Everything.
Yep, everything can be put in there. Okay, so once I suction up maybe a pint of that enzymatic cleaner, then I'll take off this red button. I grab it by the by the black rim, and I just pull it off. And often that's pretty dirty in there, depending on what your procedure you were doing. So you'll put that in the enzymatic cleaner as well, and brush it if it needs brushing. Then you take your biopsy cap, that comes off. There's 10 more of these in that case if you need them. That goes in the enzymatic cleaner. So now we have that port and that port exposed, and we're going to take a cleaning brush. Should have had this pre-opened for my video here. Do you mind opening this? Yeah, there's a perforation, I think, right there. There we go. Thank you. All right, so this is a two-ended cleaning brush. It's meant for single use. You want to make sure that you always have this little ball at the tip of the brush. That prevents damage or trauma to the channel or the scope. So the first place I'm going to go with this, they're going to go 3 places. Straight down into where that suction button was. Now I'm going to push it, and it's going to come all the way out the tip of the scope. Okay, and now you pull it because it's a double-ended brush. That way you get 2 brushes into the channel. All right, rinse the brush. Now you go down where the biopsy goes. So that's actually cleaning the same channel. It's just also getting this spot right here where they junction. Push it all the way through. Comes out the tip, pull it out to the tip, okay? And you're not scrubbing, you're just going through once. And then I'm gonna disconnect my suction, just because this is where the brush is gonna come out next. I'm gonna go back into where this button was, but this time I'm gonna angle it in this direction towards this big cable right here. So now I'm going that direction, and I'm going all the way back, and it's gonna pop out this Christmas tree back here. Okay, this is the one spot you can use force because it's a metal tube that makes that turn. But there's our brush out the Christmas tree, and we just pull it through. Okay, now we're done with our brush. And then you'll replace your suction button, provided that it's been cleaned off, and your biopsy cap. Wipe down the scope and the enzymatic cleaner. Now take it out and put it into clean drinking water is what the manual says. Distilled water is always better just because it doesn't leave spots or crystals and stuff like that. But you can put this in water, hook up your suction again. And now I'm gonna hit the suction button and suction up water to rinse out that enzymatic cleaner that was in there. And let the water rinse the outside of the scope to get the enzymatic cleaner off as well. Then once you do that, you take it out of the water and you'll leak test it one more time. And the reason is you wanna make sure you didn't damage it when you did the brushing, or you didn't expose a hole that was not quite there, or that was plugged up with a mucus plug or a piece of food. So we leak test it again, and it is good to just rotate the dials a little bit as you're leak testing, because sometimes if there's a leak in the bending rubber, it could be right here, a real small leak, but it's not showing because it's crinkled. And then if it's ever slightly moving and you're not sure if it's a leak or not, then what you do is you just pump it up to that blue area and put the first 30 to 40 centimeters into water. And if you see a steady stream of air bubbles coming out, that's a leak. If an occasional bubble comes out, that's no big deal because there's just air pockets in the suction channel. But so again, no leak. Press the button, release it, and now you can hang your scope up and let it dry. And then you're pretty much done cleaning it. If you have to disinfect it, there are ways to cold soap disinfect it, or gas sterilizing is the best way to go. All right?
Perfect.
Good job. Cool. Thank you. I've done that once or twice.
Yeah.
Yeah.
So